It's Lindsay Smith-Rogers, producer and co-host of Public Health on Call. Thank you for joining us for this season of the podcast. We'll be taking a break the week of May 25th, returning for season 14 on Monday, June 1st. As always, please keep sending your ideas and questions to publichealthquestion@jhu.edu, and thanks for listening.
Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers, producer of Public Health on Call, and today we have a special treat for you, a behind-the-scenes look at what it's like to lead the Baltimore City Health Department. In celebration of National Public Health Week last month, our host Stephanie Desmon led a panel with 5 current and former health commissioners serving from 1992 all the way up to 2005. Peter Beilenson, Josh Sharfstein, Lena Wen, Letitia Dzirasa, and Michelle Taylor discuss the most pressing issues they faced during their tenure, trade some wacky animal control stories, and reflect on the human side of what it's like to lead this premier health department. Let's listen.
Good afternoon, everyone. I'm so great to see so many faces here today. My name is Stephanie Desmon, and I am the Director of PR and Communications at the Johns Hopkins Center for Communication Programs. I'm also co-host of the Public Health on Call podcast with one of our esteemed guests, Dr. Josh Sharfstein. I met Josh Sharfstein about 20 years ago. I was a reporter at the Baltimore Sun. He was the city health commissioner, and I came to meet with him, and we ended up chatting while we walked over to Chipotle to get his lunch. So this is a pretty special conversation we're going to have today for Public Health Week. We have leaders here who've shaped public health in Baltimore across some of the most challenging and consequential moments in the city's history. We're talking about the height of violence and HIV in the 90s, the scaling of treatment and prevention, the shock of fentanyl and the aftermath of Freddie Gray, the COVID-19 pandemic, and now a moment where we're seeing real progress but still facing serious challenges. So today is about pulling back the curtain a little bit. Each of these commissioners stepped into the role at a very different time and had to figure out in real time how to respond. So we want to talk about what worked, what didn't, and what it actually takes to move the needle in a city like Baltimore. We'll keep it moving, we'll leave time for questions, and hopefully have a little fun at the same time. So first, I'd like each of you to please introduce yourselves, tell us when you were a commissioner and what mayors you served under, and we'll start with you, Dr. Beilenson.
I'm Peter Beilenson. I served from 1992 to 2005, and I served under Mayors Kurt Schmoke and Martin O'Malley.
Great. And I'm Josh Sharfstein. It's so great to be here and see everybody. I became health commissioner in December 2005, December 11th, I think. And then until March of 2009, I worked for Mayor O'Malley and Mayor Sheila Dixon, who is with us here. We invited a bunch of mayors. Mayor Dixon came, which is thus proving her public health credentials.
Hi, everyone. I'm Lena Wen. I was appointed by Stephanie Rawlings-Blake, Mayor Stephanie Rawlings-Blake, in 2014. I served until 2018 and also under the administration of Catherine Pugh as well.
Good afternoon, everybody. Letitia Dzirasa. I was appointed by Mayor Catherine Pugh. I started on March 11, 2019, and served through June 2019. I served under Mayor Pugh, Mayor Young, and Mayor Scott.
Good afternoon, everyone. I'm Dr. Michelle Taylor. I started at the Baltimore City Health Department in August of 2025. It's been 8 months.
Well, welcome to you all. Thank you so much. I'd like to sort of start with you, Dr. Beilenson, since you are the dean of this group, I would say. I want to know what the biggest health challenge was when you started, and what did you tackle first? And I'm going to ask all y'all the same question. So let's start with Dr. Beilenson.
Well, the biggest problem was unquestionably HIV/AIDS. It was in I served in the 90s and the 2000s. And we were number one in the country in our HIV/AIDS rate. And we started our needle exchange program, which I think is the most important thing that I worked on in the 13 years that I was in the health department. And then it grew to, we covered juvenile violence and had Operation Save Kids, which was a significant effort. And we also addressed immunizations, because we were 60% fully immunized, and we got up to 99.8%. and a bunch of other things as well, which I guess I'll talk about later.
Great. Well, I would say probably the first issue that I had to deal with was overdose. I remember because we carried Blackberries. And if you remember what a Blackberry is, you would also remember that there was a pin function where it would rattle in this really jarring way. And the mayor loved to send pin messages. And on my first day, the thing was making this noise. I didn't know what it was. And I had 4 pins from him asking what I was doing about overdose. On my first day on the job, was building on a huge legacy from Dr. Beilenson and many others in the city to grow the treatment system of Baltimore. One of the biggest challenges, though, there were really long waiting lists, and it was really hard for people to get treatment. And we had a couple interesting advantages. We had a new drug that had just been approved called buprenorphine that could be used not just in an opioid treatment program in a methadone clinic, but by any doctor. And we also had the advantage that Medicaid had expanded a little bit to be able to cover some addiction treatment. And so we went all in. It became the first city to pay for every doctor's training. We had hundreds of doctors who were involved. We scaled up treatment tremendously, and it was a big contributor to what turned out to be about a 75 or 80% reduction in overdoses. But before we go any further, though, I just want to say, we are also joined here by some of the people who really helped make that happen. The person who was chief of staff every day that I was city health commissioner, Michelle Spencer, is here. The head of school health, I think under all 5 of us, Francine Childs is here. You could do a panel of all 5 of us, or you could just interview Francine. Those are the options, and there are many, many others here. So I can't acknowledge everybody, but I just wanted to say that.
I personally think that it would be great if Francine could give the panel on what it was like to work with all of us. That's the after, right? The postscript of all this. I'm joking, but no, it's wonderful to see you and to see so many of our wonderful partners in the city here, including Kevin Lindemuth, CEO of Healthcare for the Homeless, was one of our tremendous partners in the city and still continues to be. When I was first appointed by Mayor Rawlings Blake, we had discussed working on children's health as our number one issue. Her mother was a pediatrician. It was something she was very passionate about. And I remember distinctly during our interviews, during our discussions thereafter, that's what we said would be our top priority. And then I started doing listening tours and meeting people around the city, including, I remember this one panel of kids, like teenagers and younger. I mean, some of the kids in that panel, I have 2 kids. My kids are 6 and 8. And some of those kids were 8-year-olds were in that audience. And we had discussed at that time, or my question for all of them was, well, I'm new at this job. What do you think that I should be working on? I think it should be children's health. I had said as an example to folks, and people said, sure, why not? Obviously, nobody's going to say they don't think that's important. But what was really striking was that so many people, really everyone, including these children, named mental health and addiction as the number one issue that they wanted for us to be tackling in the city health department. And it was so striking because these young people were not necessarily saying, I want you to work on substance use disorder, right? They were telling me just heartbreaking stories of what it was like to be in a family where everyone was addicted to drugs and they were the only ones who got up in the morning. Or what it was like to have multiple members of their family be killed or be threatened or be involved in various violence-related issues. And I think it was hard to then say, well, we don't want to address this, right, as the top issue. So we worked on a lot of things following on the programs that Josh and Peter started on overdose prevention, on increasing addiction treatment. But I think that all of that really came from the residents themselves.
So within my first 90 days, I had what I call the 3M. We had a measles outbreak, we had a transition in mayoral leadership, and we had malware hit the city. Mm-hmm. So my first 90 days was a whirlwind, and that was pre-pandemic. So I will say, I came in and, similar probably to everyone up here, did listening sessions, had lots of ideas. I'm a pediatrician of what I thought I wanted to address. But of course, by March 2020, my ideas certainly were relevant and what I heard from everyone was relevant. But the focus, from that point on was COVID.
Hi, everyone. So what I will say is that first, I failed to mention that I have had the privilege of being hired and working for Mayor Brandon Scott. And he actually, in my final interview, did the interview. So the people up here understand that a lot of times when you work for elected officials, it's their staff that does the interview. that final interview. And then they may pepper in some questions. But Mayor Scott actually did my interview. And he had so many great questions and had so much knowledge of public health, which to me was the clinch for me for whether I would even accept the job if offered. And the reason he had that knowledge is because of the 4 people that are sitting up here. I knew that I would be blessed to come to a city if the job was offered, where public health was a priority. And not only was it a priority, but the people who had sat in the seat before made it their top priority to educate their elected officials and their community about the importance of public health. And so his questions proved that. The top issue that I knew he wanted me to work on was fatal overdose prevention. There's a lot in the news. There have been a lot of comparisons about the work in violence prevention and the work in overdose prevention and the number of deaths and the declines that we've seen in violence. But we're also seeing declines in overdose. And that's because of the groundwork that's been done prior to my arrival. It is truly an all-of-city approach. The mayor has an executive order that says that this would be an all-of-city approach, and we are already starting to see the fruits of folks' labor. Now, of course, like everybody else up here, I have other ideas about what I would like to do, and we've already started that within my first 90 days. But I will tell you that Baltimore and coming here and having the opportunity to work in a place and do what I'm so passionate about that also has the motivation, the will, and the resources and the community backing to do great things and build off of the legacy that's up here. It's just been a wonderful 8 months, and everybody has been great.
Well, thank you all. Those are some very interesting it's very interesting to me to hear that, you show up with one idea in mind and maybe the universe has a different idea for you, especially Dr. Dzirasa.
Yeah.
I wanted to ask something like a little bit basic. So what's one thing that you've done? And I'll start with Peter. And what's one thing that you did that really moved the needle in your mind?
I think it was needle exchange. And we had a lot of people working on that. We hired from the community, from people who had lived experiences. We had a needle exchange van rather than bricks and mortar because we thought it would be less of an NIMBY issue. We did a lot of groundwork with communities so they'd be in support of it. And it made a big difference because we went from 64% of HIV cases related to injection drug users to 9% or 8%, something like that. So it's made a big difference, and I'm very proud of doing that. And
it was one of the first in the country?
This is the third in the country. And Mayor Dixon was very supportive as a city council president at that time. And we got it approved by the legislature, including some conservative legislators that supported us from around the state. So that was a very impressive effort on the part of a lot of people.
I'd probably add for our time, birth outcome, very elevated infant mortality rate for the city and a huge racial disparity. I think the rate of death of Black babies was 5 times higher in Baltimore than white babies. And there was a series of articles and editorials about it in the Baltimore Sun. I don't know if you wrote any of those, Stephanie, and I remember getting called by the Baltimore Sun for the editorial, and they asked us, what was going on. And I basically said, not enough, this has to be a priority. And it was a very kind editorial. And they said, well, we look forward to seeing everything the health department's going to do, which is just a sort of a bit of a through theme for this job. I think in other places around the country, the health department is in the room and people go like, why is the health department here? In Baltimore, it's like, it doesn't matter the topic. It's like, could we get the health department involved? So whatever it is. So birth outcomes obviously is a big, big public health issue. And we were able to hire someone to develop a strategy for birth outcomes that became Be More for Healthy Babies that is now, going on a lot of years, 15 years, and has absolutely both lowered the overall rate to historic lows and narrowed the disparity through a huge community engaged campaign.
I love the Be More for Healthy Babies example. I think it also is such a tangible example of what public health does. when public health so often is so abstract, right? And I think a lot of times people see, if you define public health as we're going to cut, cardiovascular deaths in 50 years, it maybe doesn't have, right? People don't understand really what you do as opposed to free cribs or postpartum support or family support. It's much more tangible. But yes, thank you for that. For my time, it would be around overdose deaths prevention. We were one of the first jurisdictions in the country to issue the standing order for naloxone. We worked with our state lawmakers to pass legislation in the state, essentially allowing me to become the single prescriber for everyone in the city for naloxone. So it was the equivalent of signing 620,000 prescriptions for naloxone, which was a little bit frightening. But no, we worked also with our partners, and I think it exemplifies, the naloxone example for me exemplifies why this job is so special, because you directly get to influence policy, city, state, federal. You also then work on services, because we found out, for example, that a lot of pharmacies were not aware of the standing order. And so we had to go door to door in the pharmacies to let them know. We had to work with community members and community organizations to get the knowledge out to individuals as well. Needle Exchange Fan and the folks on the ground in Needle Exchange were a huge part of that as well. And then you provide educations, right? So you work on all three facets, the policy, services, education all together. And within a 3-year period, everyday residents used naloxone to save more than 2,000 lives that were documented of fellow citizens in the city. And just to give you an example, Josh had mentioned how he got the pings of problems and everything feels so personal to you in this job, right? I remember my older child had just been born, and I was in this state where, I was confused about what time it was. I was like, I'm trying to figure out how to be a mom and work and all these things. I remember going to the grocery store, and I wasn't used to like pushing a stroller or maybe lifting a car seat and then pushing groceries, like all this. And I was kind of discombobulated. And finally went to the cashier. The cashier said, I need to tell you something. And I thought she was going to say, like, I don't know, something with your baby or whatever, right? Like, you don't know what you're doing with, which I clearly didn't. No, she said, I want to tell you about my son. And she showed me a picture of her son, who looked like he was maybe in his 20s. And she said, my son is alive today because of your naloxone prescription. She said, we always knew that, we knew that he was struggling with addiction issues. We made sure that we carried naloxone in the house. And one day he overdosed and we were able to save his life. That is how personal this job is, right? That you are meeting the people whose lives you're impacting every day.
Yeah, I think for me, particularly reflecting on our time during the pandemic, we were a department that strove to be both data-driven and community-informed. Yeah. And sometimes you see where agencies will focus on the data, minimal community engagement. And we were an agency, I think, that knew that we had to do both, in part, again, because of everyone sitting up here before me, that we wanted to be transparent in what we knew about COVID. We had our dashboard up pretty quickly, but we also wanted to be, community-informed. Right. And so listening to the community about where did we need to set up mobile vaccination? Where did we need to set up mobile testing? What communities were most impacted? And what message resonated the most with those communities in order to have the impact that we wanted, to get as many people vaccinated as possible, right? And so I think combining those two contributed to many of the successes we had throughout the pandemic.
All right, my turn. Moving the needle in 8 months. So for all of my students in here, you know that is absolutely impossible. But what is possible is understanding where you are when you're sitting in this seat, especially at the beginning. And so I shared with you that Mayor Scott interviewed me. But the other thing that he and his team say all the time is they hired me because I had done this job before. And most people who come into a commissioner role have never done this job before. So imagine that. And I was one of those, right? Right. Raise your hand. For who did this job before you sat in the seat. And that's important because it is on-the-job training every single day. There are several health officers from across Maryland who are here who can also give you the same story, right? So in order to move the needle here, I know that one of the things I need to work on, and I talked about this in our recent Partnership for Healthy Cities trip, is trust building. Coming out of the pandemic, trust building with the community is so important. And I really do believe I got hired because a lot of what I was doing in Memphis at Shelby County Health Department had to do with rebuilding trust in the community. true community engagement, getting out, being a hands-on commissioner, having people stop you in the grocery store and say, hey, thank you for what you do every day. Thank you for helping us get through COVID. Thank you for making sure that my child could get vaccinated because I don't have insurance, right? So trust building and understanding that it happens, and I told them this there at the summit, it happens early, it must happen often, and it should be ongoing. The public only understands what they need at the time that they need it. And everybody is coming to you with different needs and different gaps. But one of the things that they know is that you are one of the people sitting in this seat who can help them. You control the workforce who is providing those services, right? So what you'll find, especially to my students, is that when you work in a local health department, people will tell you, well, I work for the aging division, or I work for the Bureau of Maternal and Child Health. The public doesn't see that. They just see you work for the Baltimore City Health Department, and I have a need that I need you to fill. And so it's up to us to constantly be building that trust where we say, not only am I going to fill that need, but I'm going to fill that need well. I'm going to educate you about how we get past this need so that we're filling in those gaps. And so for me, moving the needle means building upon this legacy that these folks have built, that so many people in the community here in Baltimore have built, to make sure that the community knows that when they approach Baltimore City Health Department, they're not only going to get what they need, but they're going to get the education that they need to thrive into the future and to have healthier lives.
Well, you guys, your stories have really gave me chills. So I appreciate giving us sort of the personal side and the relationship building and how important that is to doing the work that you do successfully. I want to talk to you a little bit about the human side. So what is this job like? What is it like to have this job? I know Lena and Josh talked about getting pinged by the mayor all the time. I'm wondering, we could start wherever you want to do, but like what's something unexpected about the job? Maybe your hardest day, the most unusual situation? I'll let Josh start.
Well, there are a lot of unusual situations. This is one of the only jobs where you get the call when there's an ostrich running around the inner harbor. That definitely.
Vietnamese
potbelly pig. Yeah, so there's some things. So I'll stick with the animal control theme, although we could go into different themes. But typically, you don't understand how much you're responsible for in this job until it hits you. And, I got a call once and they said, well, there's a stable at the corner of Penn and North. It has a bunch of horses that are owned by a group called the A-Rabbers. They sell fruits and vegetables off the back. And the fire department inspected, and it was a huge fire hazard, so they condemned it, but there's no place to put the horses. And the people are very unhappy because they want to keep their horses there. And Fox News wants to do a story, and they're outside, and the mayor sent them over. And then there's like this pause, and I go, there's a stable at the corner of Penn and North, and I'm responsible for that. Why? And it's like, well, it's an animal control thing, and you have like no actual authority, but you're responsible. And I mean, just fast forward, we had to find horse rescuers. We had to move the horses to the Laurel racetrack and then back to Pimlico. And I remember one moment and we had to build trust with a group that, for a good reason, it was very distrustful in the city. And I do remember at one point, Thomas Kim, who is the chief financial officer, at one point they were actually moving the horses down into the horse truck, which I have no concept of beforehand. And he just came up to me, and we had bought water and supplies and food for everybody just to build the trust. And, we delivered on what we promised. And Thomas whispered to me, Josh, if you ride one of these horses down onto the truck, it will become an iconic image in public health. And I was like, I'm going to take a pass on that one. I am not going to risk that image. It may not be iconic in the way that you want it to be. So that is not going to happen.
Oh my gosh. Yes, there are so many animal control stories. Oh, I'll tell you one. I wasn't intending to tell an animal control story to your question, Stephanie, but okay. So we had one of our animal control vehicles was stolen. And we initially thought, okay, this is like a police matter, right? We need to be dealing with this from a security standpoint. And then they said, no, this is actually a public health issue. And I said, why? And it was because somebody stole, so there was a raccoon that was suspected to have rabies that was inside the vehicle in a cage. Okay, and the people who stole the vehicle did not like the fact that there was a raccoon in the vehicle, so they threw the raccoon and the cage out, or at least it was on the street. But the problem was we did not know whether the person was bitten by the raccoon, and therefore they threw it out. And so we began trying to approach this from a public health standpoint of not just looking for the person who stole the car, but also a person to potentially administer rabies vaccines to. So anyway, okay, so I was thinking about the difficult part of the job, to your question, right? I think the most difficult part of the job actually is managing the different constituencies with one another. And what I mean is you are appointed by the mayor, right? Your boss is the mayor. The mayor oversees the city, and you also are responsible for the health of the citizens. So you have, I suppose, multiple people to whom you respond to. And then you're also, of course, responsible for your employees and the people who depend on you to guide and lead, but also it's their job, it's their livelihoods, their work that they put in all their time and energy and effort, and they're super dedicated and care about this so much, but they're underpaid and overworked. And it always feels like our employees would say, whenever the budgets get tight, you're asking people who are already doing 2 or 3 jobs to do 3 or 4 jobs, right? And then they know that they end up having to cut corners and not do an ideal job in the things that they're already doing. I know there are a lot of health officers and people who work to health departments will understand this very closely, but you're asking people essentially to burn themselves out even more. And then to have, I've heard this term used of moral injury, referencing healthcare workers who are asked to do things that they know is not optimal healthcare, medical care, but they have to do it because who else is going to do it? And I think we ask that of our public health practitioners on the ground all the time. So you're managing those individuals, and you're also being told things from up above, right, to further cut your budgets and to do more things with limited budget. And at the same time, you're asking, you have to do it because you answer to the mayor, but some of it is managing up to the mayor and helping the mayor to understand, or city council and others to understand why your work is so important not to cut the budget. But at the same time, once that decision is made, it's your job to communicate that to the people in your department, why they have to do more with less. And I think that to me was always the hardest part of this job.
I might piggyback a little bit off of what Lena mentioned. I think it is the level of personal responsibility that you feel balanced with other life responsibilities, right? I remember the first city employee we lost to COVID, and feeling a level of personal responsibility, right? Like, I am the health commissioner, responsible for the resources, responsible for providing education, responsible for managing expectations when everything is so uncertain. And that is a great level of just personal responsibility in this role. And then outside of these roles, we all have families and people who depend on us that we support as mom or wife or husband or friend, and just having to balance that is no small feat.
So I will tell you that I have to do an animal control story because that is one of the most important, just interesting parts of the job. And yes, I have a story just 8 months in, right? I cannot remember what the type of cat this is, but to me, it looked like a whole bobcat roaming around Baltimore. Now, here's what's funny, because this is a 24/7 job. And if it's the weekend or it's midnight, you're going to get that call, and it's usually going to be an unusual call. For me, I'm in the Tennessee Air National Guard still. I still pull 1 weekend a month. And I was in Memphis, and I found out that there was this bobcat-looking cat roaming the city streets from a friend. Because, see, the commissioners can also tell you that your friends, when they know you're commissioner, if something really crazy comes across the news, they're like, did you see this? They'll text or they'll call you, did you see this? So I'm getting this picture. So my special assistant, real story, I looked at the picture. I'm in uniform. I'm sitting at my desk between patients. I was like, what is this thing? And what's going on? And so I called her. I said, Victoria. She said, oh, no, animal control already caught them, right? They got the first cat, but now we're getting calls about a second cat. Excuse me? I said, well, where's the second cat? Well, the owner already got it and took it back in the house. I said, well, did somebody go and get that one too? well, the rules say that if they took it back in the house, we've got to get an order first before we can go in their house and get the cat. I said, but it's an illegal cat. So, you really, when you're doing this job, you never know what the call is going to be. The most difficult part of the job is the change management piece, all right? And I can say that for certain because I'm in a second situation where this is the case. So whenever you have a leadership change and you have a vision for where you want to take the organization, one of the biggest pieces that you have to do as the leader of that local health department is get people on board with where you would like to go. Because like Lena said, these are people's livelihoods. They've been used to doing a job. They've been used to doing a job description that was probably written maybe 5 or 10 years ago. And a lot of times what happens, and this is just human nature, they may have read the first 3 bullets of the job description, but they didn't read the other 6. So when a new person comes in, they're like, well, your job says that you do all of these things. And they're like, no, I just do these first 3. That's all that anybody ever required of me. So the change management piece is to say, okay, I understand that you've been doing more with less. I understand that you've just been doing the first 3. But let's talk about how we not only reimagine the first 3, but how we bring in the other 6. That's the really difficult part of the job because folks don't have to do what you say, right? Yes, they want the paycheck. Yes, things get done. But really, as a leader of a local health department, you want things to be done well, no matter what the resource line says. You want them to be done well, and the community deserves to have those things done well. And so that is the most difficult part, is getting everybody aligned with the vision that you have, and then making sure that you do everything possible to support them to be able to do those jobs well.
Well, I'm one of those people who learned on the job. I was 32 when I started in the position, and I was younger than virtually everybody that worked in the health department. Fancy, maybe you agree. So I had to learn on the job, and my story is related to animal control as well. Roger and Lucy and Barbara may have these same stories. They're health officers from the variety of health counties around us. But I had 13 years to accumulate stories from animal control. And my 2 favorites were, one was a dead horse that died in the middle of Light Street. And we had to figure out how to lift it up and take it away, which was difficult to do. And the other, my favorite of all time, is the fried rat, which we had at Popeyes. There was a call that there was a fried rat at Popeyes. I like to go out and visit things. I didn't like to sit behind my desk, so I went out to Popeyes. And in fact, there was in a fryer a fried rat that a disgruntled employee had put in the fryer. So that's my animal control story.
Well, we could do a whole session on
We could.
An animal control, but also restaurant inspection. I'm getting hit with a lot of memories right here. We had a certain city council president, not this city council president, but one who called me and he said, I am furious with you, Dr. Sharfstein, furious. I said, why is that? You closed a restaurant just because it had a Jack Young for city council president sign in the window. How could you do that? Shame on the health department, shame on the health department. And I went, council president, that would certainly be wrong if we did that. Could I look into it and get back to you? And then I looked into it. I called him back. I said, Mr. Council President, I just want to give you an update. There were mice in the bread basket.
Yeah.
Okay. And like 6 people called and we went out. We had to shut down the restaurant. And he said, I am so disappointed in you. And I said, why? He said, that you couldn't shut it down faster before they put up a Jack Young for council president.
I imagine there's not a lot of animal control taught at medical school.
No, there's not.
So I wanted to ask one more question before I get into the questions from some of you. By the way, we have Slido. If you want to ask questions, you could type them in. We also have a microphone stand over here if you'd like to come down and ask a question. But I'm going to start this one with Dr. Taylor. And let you all sort of weigh in. What are the biggest public health challenges right now?
Gosh, give me the hard question. I would say right now, the biggest public health challenge is what we're experiencing as far as chaos in the system at the federal level. That is the biggest challenge because what a lot of people don't know about public health, especially local public health, is that we are largely funded by grants, federal grants, state grants. And let me tell you about state grants. Most of those are federal grants too, but they just have to pass through the state, right? And then we get local money as well. But a lot of that local money also has a federal source. So right now, the current administration, for whatever reason, has decided that we are going to have chaos and confusion in the system. And that trickles down and affects our communities that we are serving, especially in urban settings, the most. Rural settings are getting hard too, but urban settings are really getting hard. So traditionally, in local public health, if a grant was ending, even 5 years ago, even 10 years ago, you would have a runway. You would have at least a year or at least 6 months where you would know it was ending. You could plan for the end. You could cross-train your employees. You didn't have to do any layoffs. You could do all kinds of things, because the other thing that you find out as a commissioner is that when you come in, the vacancies abound, right? Because we do really good training and then people go and find other work, right? And so you can cross-train people into those other positions, but you got to have time to do it. Now, we have experienced, especially within the last year, moments where we will get an email that says, cease and desist all work as of yesterday. What do you do with that, right? Just like we've talked about this whole time. These are people's livelihoods. We're talking about salaries, fringe, supplies, the entire program just cut overnight without warning and without a chance to plan. So, perfect example. Right before I came here, we got a cut in the health disparities grant. They just said, literally, cease and desist all work as of yesterday. All right? I've got health officers in here who know what that email looked like. And we had to figure out how to place 18 people that we had on that grant in other places in the health department. And I'll tell you, we couldn't find placements for all of them, because you still got to have money in the budget line to actually put them there. And the ones that we could move, we had to do pay cuts. So I will say the biggest difficulty right now is what we're experiencing with chaos and confusion. Yes, we can talk about health-specific things all day long. We can talk about HIV rates rising again. We can talk about syphilis rates just ballooning right now. We can talk about making sure the infant mortality rate doesn't start to go up. We can talk about fatal overdoses and making sure that doesn't start to go up again. But really introducing that chaos and confusion in the system that we rely on so heavily to make sure that we can provide the services and programs that we provide is the biggest threat to public health right now.
Thank you. Anyone else like to add?
I think I'll just say I totally agree with you. So my work now, I write columns for the Washington Post on health policy, medicine, and public health. And I am trying to tell these stories of impact, because I think people read the news and frankly, it's confusing, right? They read that, oh, well, some cuts were made, but then some funding was restored. So what's the big deal? Or they think, well, there's all this uncertainty, things are held up in courts. What's the big deal? Well, the big deal is this confusion, right? I interviewed a health officer in Texas who was explaining to me exactly this, that even if something is technically restored because of pending court cases or something, you're not going to be able to hire back all these people, right? Many of them have found other jobs. There are community organizations that you can't pay who don't want to work with you again. People don't trust the health department. People don't trust that the funding is going to come through. And I think that's a big issue. We're also losing generations of young people too, who might before, it was already difficult to get people to work in local public health because the salary is lower, right? And people go exactly as you were saying, Michelle, to other places once they have worked with us and gotten the experience. Now it's going to be really hard to convince people to come and work with us. And I think we're losing generations of people who otherwise would have pursued careers in science and medicine and public health because of that same fear too.
I would just quickly add that I think Michelle's story and her leadership in this area reflects that this job is not just a job under the dome of Baltimore City. It has implications for the state, has implications for the federal government. When Peter started needle exchanges, that was a huge national story. When I was health commissioner, we petitioned the Food and Drug Administration and got all the cough and cold medicines off the market for small kids. I know you were blocking certain grant actions on reproductive health. The efforts on the pandemic were noted around the country, and it really, what makes it a great job. At the same time, you're telling the story, you're also a tremendous advocate, and you're able to shed light on what's happening at the federal level, even as you're totally responsible for what's going on in the city.
Before I go to questions, I know that Dr. Beilenson, you're teaching undergrads right now at Hopkins in public health. So what are you telling them?
I'm telling them go to a different field.
I'm not really telling them that.
I've actually found that I teach undergrads at Hopkins on public health and politics and public health and public policy. And I found that there's the same number of students are coming each year, and they're just as engrossed in what they want to do. And there's concerns about the chaos that's going on. But I think if we continue to turn out people who are public health folks, we'll do okay.
They will.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.